Without further ado, I'd like to introduce today's moderator, Kerwin, the Executive Director of the Center for Migration Studies.
Thank you, Emma. So yes, our topic today, immigrant essential workers, the COVID-19 pandemic, and community responses. We're going to start off hearing from CMS researcher Mike Nicholson on a CMS report on immigrant essential workers by state and by immigration status. Mike will also be presenting some information that hasn't been released or reported on to date. We'll next hear from Daniela Alulema, CMS's Director of Programs, who will profile DACA essential workers from a paper that she's written at a time when the Supreme Court decision on that program is looming and that population is facing potentially two major crises. We'll then hear from our very accomplished guests, and we're very delighted and grateful to them for being with us today. Zulma Maciel, Juan Cerda, and Laura González-Murphy on their work with immigrant communities in San Jose, Dallas-Fort Worth, and New York State, respectively, and you can see their titles on the screen. What they'll speak on is their community's work during the pandemic and also the community's longstanding commitment to immigrants, which I think is very important, and why they feel that this is important. All of these presentations will take a total of maybe 40 to 45 minutes, and we'll try to devote the last half hour to your questions and comments. Next slide, please. Before I hand it over to the speakers, let me make just a few framing comments. It's clear that the pandemic has exposed social inequalities and injustices in our nation. The United States, which is a nation with 4% of the world's population, has experienced 29% of the world's deaths from COVID-19, with vulnerable populations, including immigrants, particularly hard hit. The federal response to immigrants during this time has been dismal. One overarching theme is that the administration has been advancing its pre-pandemic agenda for immigration and immigrants through its pandemic policies. So it's closed US borders to asylum seekers and unaccompanied migrant children, violating US asylum and anti-trafficking laws. It's suspended refugee resettlement and the issuance of immigrant visas based on family ties and employment. It's continued to build the wall, which it now is painting black at a projected cost of $500 million just to paint it black. And so as to burn the hands of migrants that touch it. Black is considered a color that will hold the heat better. It has not suspended the public charge rule. Thus, we continue to receive reports of immigrants and their family members sick with COVID-19 who will not access health services or benefits for fear it will compromise their attempt to secure status down the road. The US also continues to detain nearly 30,000 persons in what for many have become life-threatening conditions. We document these issues on that page that's listed on this page, the COVID-19 migration-related developments page, so we hope that you'll look at that. This crisis clearly demands a unified community-wide response, but federal policies have too often excluded and marginalized certain immigrants and their family members. The CARES Act, for example, denies federal tax rebates to persons who have filed tax returns but who lack Social Security numbers, or in the case of joint returns, if either spouse lacks a Social Security number. So individual taxpayer identification numbers, or ITINs, do not suffice. This requirement is surely excluding many US tax-paying mixed status families from obtaining badly needed relief during a crisis. To give you a sense of its impact, 18.3 million persons live in 3.8 million mixed status households in the United States. The CARES Act also denies undocumented students emergency grants to help them meet a variety of needs. Our research shows that immigrants work in essential critical infrastructure jobs at disproportionately high rates. 69% of the foreign-born and 74% of undocumented workers work in essential jobs as defined by the Department of Homeland Security. in health and infrastructure and manufacturing, service and food and safety and other jobs. Many are literally putting their lives on the line. For example, 18,000 meatpacking plant workers, a high percentage of them foreign-born, have contracted COVID-19, and 67 have died. States, on the other hand, like North Carolina, North Dakota, Maryland, and others, are giving undocumented essential workers what amount to safe passage letters so that ICE does not arrest them. And this includes some people that are even in removal proceedings. That's an extraordinary development. In short, our country needs immigrants, but our federal government views and treats them and their families in damaging ways. So we're very much looking forward today to hearing from our speakers from San Jose, Dallas-Fort Worth, and New York, who will outline a very different vision for our communities and our country. Let me now turn to Mike Nicholson to present the report.
Thank you, Don. As Don mentioned, my name is Mike Nicholson, and I'm a researcher at the Center for Migration Studies of New York. Next slide, please. The Center for Migration Studies recently published a report, as Don mentioned, that includes estimates of the number of foreign-born essential workers by state, immigration status, and by industry. In this presentation, I'll discuss some key findings from this report. As Don mentioned, we found that immigrants, including undocumented immigrants, had high rates in jobs defined by the Department of Homeland Security as critical essential infrastructure jobs. These include sectors like healthcare, essential manufacturing, construction, sanitation, and essential retail, among others. To arrive at our estimates, we first matched essential critical infrastructure categories set forth by the Department of Homeland Security to 2018 census industry codes or occupation codes where appropriate. We then used 2018 one-year American Community Survey data, which is a data set published by the Census Bureau, to estimate the number of foreign-born workers that fall into each of these categories set forth by the Department of Homeland Security. We should mention as well that some of the workers, that these are 2018 estimates, so some workers may have been furloughed or lost their jobs since then. So these numbers should be regarded as sort of an upper bound of essential workers. Next slide, please. So some of the key findings of our report include that immigrants work in essential critical infrastructure jobs at higher rates than natives. Many essential workers, immigrants, 19.8 million immigrants work in these essential critical infrastructure jobs. Of these, 9.6 million are naturalized citizens, 4.6 million are legal non-citizens, of which the most part are lawful permanent residents, and 5.5 million are undocumented. 69% of the foreign-born labor force works in essential critical infrastructure jobs, relative to 65% of the native-born labor force. Next slide, please. So immigrants constitute 18% of all workers in critical infrastructure categories. So this suggests that immigrants are a vital component of the critical work of the essential workforce in this country. And this share is even higher in many states. In California, immigrants make up 36% of all essential workers. In New York State, immigrants make up 31% of all essential workers, and they make up 24% of all essential workers in Texas. Next slide, please. Many immigrants are working in healthcare and healthcare-related manufacturing, and many of these are on the front lines working with COVID patients. Immigrants make up 16% of all US healthcare sector employees, and 24% of employees in medical equipment manufacturing, as well as 25% of employees in pharmaceuticals manufacturing. Next slide, please. Immigrants also fill vital sanitation jobs and thus are working to keep Americans healthy during the pandemic. They make up 28% of janitors and building cleaners and 23% of workers in disinfection. Next slide, please. Immigrants are also vital to food supply chains. They make up 31% of US agricultural employees, 21% of US workers in food and beverage manufacturing and processing, and 26% of grocery wholesalers. Overall, these estimates suggest that immigrants are truly essential to our health and well-being. And before we introduce our speakers from San Jose, California, and Dallas-Fort Worth, Texas, I'll also share a few new findings on essential workers in those metro areas. Next slide, please. Immigrants make up 50% of essential workers in the San Jose metro. This is the highest share of any metro area in the country. 20% of immigrant essential workers in the San Jose metro work in computer-related and electronics manufacturing. These immigrant essential workers are also concentrated in the restaurant sector, construction, hospitals, and in janitorial and building cleaning jobs. Next slide, please. In Dallas-Fort Worth, immigrants make up 27% of essential workers in the metro area. 22% of immigrant essential workers, a plurality, work in the construction sector. So these immigrants will be vital to our economy as it recovers from the COVID crisis. Immigrant essential workers are also concentrated in restaurants, in transit, in janitorial and building cleaning jobs, and in hospitals. All in all, immigrants are essential to not only the economy, but to the health and well-being of Americans during these difficult times. Thank you very much, and I'd like to introduce our next speaker, Daniela Alulema, who's a director of programs at the Center for Migration Studies of New York.
Thank you, Mike. In this next section, I will present a brief profile of DACA recipients, particularly those who are in the front lines of this pandemic as essential workers. As you know, DACA recipients are immigrants who arrived to the United States as minors and have studied, worked, contributed, and made a home in this country. The DACA program was created by the Obama administration in 2012, and it was meant to act as a temporary stopgap until Congress enacted a legislative fix. Under DACA, qualifying immigrants obtain a 2-year work permit and reprieve from deportation. The Trump administration ended the program in 2017, and this decision was challenged in several courts, and it's now up to the Supreme Court to decide whether the DACA program was ended legally or not. Next slide, please. According to the latest USCIS report, as of December 31st, 2019, there were 649,000 active DACA recipients. And this slide shows some demographic characteristics of this group. I will only highlight a few. For instance, DACA recipients are a diverse group who hail from over 150 countries. They live in all 50 states and US territories. The highest 3 concentrations of DACA recipients can be found in Los Angeles, Long Beach, Anaheim area at 12%, New York, Newark, and Jersey City at 6%, and Dallas, Fort Worth, and Arlington at 5%. Their average age is 26 years, 67% of them are between the ages of 21 and 30, and 76% is single, while 23% is married. Next slide, please. DACA recipients have long contributed to the US labor force, economy, and communities. And now several of them are in the front lines combating the outbreak of COVID-19. This table shows CMS estimates of the number of DACA recipients and essential activities as outlined by the Department of Homeland Security. To highlight just the top 5, approximately 100,000 work in essential retail, which includes 76,000 recipients working in restaurants. This number also includes workers in grocery stores, pharmacies, and hardware stores. 67,000 work in construction. 49,000 work in essential manufacturing, including food processing, agriculture, medical equipment, among others. Over 42,000 work in essential services, including landscapers, childcare services, and auto repair. And 33,000 work in essential healthcare occupations, including hospitals, nursing homes, and medical and dental offices. These numbers show how deeply embedded and invested DACA recipients are in our communities and how vital they are to our well-being, safety, and recovery. Next slide, please. However, the COVID-19 pandemic is not the only crisis that DACA recipients are facing. They also have to go to work without knowing whether the country that is needing them now will allow them to stay in the near future. As I mentioned earlier, the Supreme Court will decide before the end of June whether the Trump administration ended DACA arbitrarily. If the Supreme Court decides that the decision to end DACA was legal, these 650,000 young immigrants, including those in the front lines, are bound to lose their work permits, access to career and school opportunities, and face a looming risk of deportation and possible family separation. In addition, the end of DACA would also impact more than 300,000 US citizen children who have at least one DACA parent. The reality that DACA recipients are facing is captured in the words of a DACA recipient we recently interviewed and who is an educator and has a 9-year-old US citizen child. She told us, "Being a DACA recipient is really hard. It is an anxiety I and others live with every day. DACA gave me hope and made me feel like we finally fit in. It has helped me and my family financially with jobs we wouldn't be able to have if DACA ends. It helped us set goals and see beyond." Next slide, please. To conclude, I just want to share a few recommendations for DACA recipients and those who work with them in light of the imminent Supreme Court decision. First, encourage DACA recipients to submit a renewal application as soon as possible. Second, seek full legal screening to find other possible ways to adjust your immigration status. A national survey of immigrant serving organizations found that 14% of DACA eligible immigrants were potentially eligible for an immigration benefit that would put them on a path to permanent legal status. Third, stay informed about the progress and the implications of the Supreme Court decision. Fourth, know your rights and develop a contingency plan in case the DACA program ends. And finally, and this recommendation is geared towards employers, find ways to support your staff who are DACA recipients, including particularly if the program is rescinded, such as contracting options, covering renewal fees, and providing other resources. The last slide in today's presentation will have some links to useful resources for legal programs, universities, and immigrants. And with that, I'll pass it on to Zulma Maciel, Director of the Office of Immigrant Affairs of the City of San Jose.
Hi, good afternoon, everyone. It's a pleasure to be here and to be serving on this panel with these distinguished experts in the field of immigrants and refugees. I am the Director of the Office of Immigrant Affairs with the City of San Jose. I was appointed to this position 5 years ago, and it really has been a privilege to work in this capacity and to create community with not only our immigrant and refugee very diverse communities there, but also the nonprofit organizations who all aim at trying to make San Jose a much more welcoming and inclusive place for everyone who is called San Jose home. I also am currently sitting in a very unique position because while my full-time job is directing the Office of Immigrant Affairs, I'm certainly serving in the Emergency Operations Center, serving the Emergency PIO, which is a public information office, food and necessities, as well as a local assistance center in virtual form. So I've had a unique opportunity to be able to see the COVID-19 pandemic and the effects that it's had on our community, particularly the communities of color, and primarily Latinos who are at the highest risk of being infected with COVID and who are currently at the highest rate of infections and hospitalizations. So we're starting to, I think what's been really interesting over the last several weeks is how we knew that there are inequities in Silicon Valley, and certainly the pandemic has illuminated the inequities. So trying to deliver and to deliver services in a way that's much more targeted has become increasingly important in the work, and ensure that it's not parity across, because it's not equal. It's really ensuring equity in the way that we deliver services. So just a little bit about San Jose on the next slide. For those of you who are not familiar with San Jose, it's in Northern California. It's the 3rd largest city in California, the 10th largest in the US. And it's also, as we like to say, the capital of Silicon Valley. And with the name of the capital of Silicon Valley, most people think of the high-tech companies that are locally, that are here, like Zoom on this platform, Cisco and Apple and Facebook and Twitter, LinkedIn, all of these high-tech companies, which is why I think, people think, well, that's where all the money is. It's where the technology is. But it really is a tale of two worlds here, and it's the haves and the have-nots, and there are some deep disparities there. What's important to note is that San Jose has always been an immigrant gateway for those who have the 50% who have bachelor's degrees. 50% of immigrants who are here have bachelor's degrees, and nearly 25% have advanced degrees. So then there are those who have arrived to San Jose with H-1B visas and other types of work visas who are working in the high-tech industry. Then there are those who have been established here from particularly Mexico and other parts of Central America, some with status, right, green cards, and some who become naturalized. And then you have the nearly 200,000 people in the county, at least Silicon Valley wide, who are undocumented. And also, as we know, DACA recipients. So we have a very interesting mix here, and I think it's important to set this context, because while we have it's really a city of thirds. A third of our population is Latino, a third API or Asian Pacific Islander, and a third white. And in that 40% of immigrants who are foreign born, we have a pretty large range of talents as well as needs. And so the Office of Immigrant Affairs has really, over the last, I would say, since the elections in 2016, as of 2017, we really have been focusing most on the most vulnerable community and working in partnership with community and community-based organizations to make sure that we protect, defend, and empower those who are at most risk of either deportation or falling through the cracks in Silicon Valley. So before I go on to the next slide, I feel like you need that context, because as we were responding to COVID-19, and thank you, Michael and Don and Daniela, for setting the context in terms of the data. I'm not going to get into the data, but as was said earlier, 50% of the essential workers are foreign-born immigrants here in San Jose. And what that means is that they are exposed to COVID. They are working close proximity with other people, and they don't always have the personal protection equipment. Well, we also know that many of these essential workers are undocumented, which means that they are not receiving the federal aid or financial relief like the stimulus check. They're not receiving unemployment insurance, and they are afraid to seek medical attention and really have been in hiding, and that's our biggest concern. And so on the next slide, you're going to see really what the Office of Immigrant Affairs, because I'm wearing both hats, and I guess it really has been a blessing in disguise to be wearing both hats in one place, which is not only serving the Emergency Operations Center, but having a very keen interest in what's happening with the undocumented community, as well as ensuring that equity is applied in the way that we prepare policies, programs, and practices. So these are just some of the examples of the things that we've done recently. And what's so interesting is that it took an emergency to act quickly, right? To work with urgency, to make things happen that we thought would not happen either in our lifetime, or that would take a really long time to get there. So I think other cities have probably done some of this, but what's, at least for San Jose, I mean, there's much more work to do. And while we're most concerned about public health now, we're also intent and very much concerned about the economic recovery of our communities. So some of the policies, I'll just name them briefly, is the rent moratorium. Essentially, it means that people don't have to pay the rent during a certain period of time. This has been extended through the end of June. But of course, this is just sort of a Band-Aid problem. It fixes the current situation of people who are unemployed and don't have access to financial relief. But what happens when the moratorium is lifted? So we're also trying to put into place to make sure that we put a ban on evictions for a certain period of time, that people have about 12 months to repay back the rent that they weren't able to pay over the last 3 months. ideally, we would have a different kind of relief, right? Because a lot of people are not going to be able to keep up with the payments on current, the rent in July, August, September, still pay back the rest while they're unemployed. Another piece is emergency paid sick leave ordinance, which it essentially covers a different set of employers and ensures that they are paying sick leave to certain employees. So that's a very specific San Jose ordinance. And then I really want to spend just maybe another 2 minutes that I have left to talk about the programs and practices. So in the financial assistance area, soon after we were put into shelter in place, there was fundraising that happened quickly through Silicon Valley Strong, which is a partnership, public-private partnership between the city of San Jose, the public sector, community-based organizations. And some of our community-based organizations have really stepped up and engaging with people who were generously gifted this particular fund, initially in $11 million. These $11 million were depleted in 3 days as soon as we opened up the phone lines and the online portal for this. There were some lessons learned there, and what we learned was that the people who understood how to navigate the online portal and quickly call the phone number had access to to some financial relief. So what we did differently this time is we collaborated with community-based organizations, and who were deeply rooted in the community, who understand and know where to identify, locate the families who need this fund the most. And so in phase 2, we decided to not move until we centered community voice. So over a weekend, a few weeks ago, we surveyed 300 undocumented people and asked, what would be a fair distribution of these dollars? What's the best way to get you the information? What's the best way to communicate not only this, but other things in the future? And what we found really was illuminating. Some things we already knew, but what they said is there's too much information online. We don't know who to trust. And we need to hear from local government and community-based organizations that our data is not going to be shared with the federal government like ICE. We want you to confirm confidentiality. We want you to make the information simple and use very little text, use more graphics, and call us or text us, use WhatsApp, right? So we then redesigned a communication strategy. We then decided that we wouldn't advertise that we have, by the way, another $12 million today that's been fundraised. And we've decided we're going to earmark these specifically for the undocumented community who are most vulnerable and at risk of losing housing and going hungry. So as a result, as of today, we have 70 grassroots organizations who really are going to be calling over the next 2 weeks people off of the 15,000 person waiting list and plucking out those that we know are undocumented and unemployed so that we can get the financial relief to them quickly. Again, this isn't enough. $12 million isn't enough. So what we really need is about $250 million to cover over the next several months. And I know that's a big goal, but it's really the only way that we're going to be able to ensure the safety net of the community. And then foods and necessities, I can tell you because I sit on that particular section of the Emergency Operations Center. We're providing 3 million meals a week, Silicon Valley wide, and the need is great and growing. Small business assistance, as well as working with Opportunity Fund to ensure that those who are not able to get relief through the federal government have access to some local loans. And then, of course, the Virtual Local Assistance Center, rethinking and reimagining the way that people get the information that they need, where they're at, in their language that's culturally responsive by people who they trust. And then finally, we're addressing racism, as everybody should. And it exists, and it sure has been illuminated, particularly around racism and the hate crimes against the API community. And so we are going to be recommending some strategies to our mayor and city council over the next several weeks to ensure that we begin to have an open conversation about how this hurts communities, and then really amplify the conversation to institutional racism, which is, we local governments are sometimes at fault for some pretty poor policies and practices. And, you know, there's a lot of lessons learned here. And so I'm, again, in a very unique position to be able to observe this and to be at the table to ensure that the essential workers in our community are going to be better at the other end of this, and not left to fend for themselves. So thank you for the opportunity. Juan Carlos, it's up to you now.
Thank you so much, Zulma. San Jose is truly a model for how to best support essential workers. So good afternoon, everyone. I'd like to thank Don Kerwin for inviting me to speak on this panel today. Just a little bit about me. I came to the United States from San Luis Potosí, Mexico, when I was 7 years old with my family. My father is an electrician and my mom was a factory worker before the pandemic took her job away. And my grandfather was what you would consider to be an essential worker because he picked fruits and vegetables in South Texas in the 1960s. So I grew up undocumented in Dallas, and I was fortunate to receive a scholarship to attend Yale University, but I never really thought that would put my education to use. And that all changed when President Obama enacted the DACA program in 2012. Thanks to DACA, I got my first job, my first driver's license, and the chance to go study abroad and leave the United States for the first time in 14 years. When I graduated from Yale, I came back to Dallas and I taught kindergarten through the Teach for America program. But unfortunately, immigration made a mistake with my information and they didn't renew my work permit on time. Even though I had submitted my application 5 months in advance, which is usually plenty of time. And as a result, my work permit expired and I lost my job in October of 2016. A couple months later, Texas passed one of the harshest show me your papers laws in the country called SB 4. That law is the reason why I became involved in community organizing. I became an immigrant rights organizer with Texas Organizing Project. But then a month after I joined, DACA got rescinded by the Trump administration. And that experience is what brought me to the Texas Business Immigration Coalition, or TBIC. It's a chapter of the National American Business Immigration Coalition. We are a growing bipartisan coalition of business leaders, employers, and associations with the mission of promoting common sense immigration reform. Some of our national co-chairs include former Exelon CEO John Rowe, Crate and Barrel co-founder Carol Siegel, and Lester Crown of Henry Crown and Company. I now serve on the City of Dallas Welcoming Communities and Immigrant Affairs Office Task Force, which is led by Liz Cedillo and Vanna Slaughter, who unfortunately couldn't present today. So Dallas has 640,000 plus immigrants living within its city limits. Immigrants are hugely important to Dallas, and I'm just going to share a couple of facts about our essential immigrant workforce, as well as what the city of Dallas is doing to support this community. Firstly, I'd like to just mention some data on our immigrant healthcare workers. Healthcare is one of the biggest industries in our city, and in Dallas, 64,737 immigrants work in our city's healthcare sector, representing about 18.8% of all of our city's healthcare workers. And on the next slide, one thing to note is that as one of the largest cities in the United States, Dallas needs a reliable and secure food supply for us to survive this pandemic. 395,888 immigrants across Texas work in the food sector, cooking, processing, delivering, and growing our food. They're 26.6% of our essential food sector workers. And then on the next slide, we also need, as a state, professionals in education who can educate our state's workforce, our next generation. In 2018, according to a study by the New American Economy, 234,691 immigrants worked in the education sector in Texas. That's 16.8% of all Texas education workers. So that's a hugely important industry for the state as a whole. And finally, I'll just mention a couple of initiatives that our city has launched to support some of our most critical immigrant workers on the next slide. So as Daniela mentioned, like our teachers, our firefighters, and our doctors, immigrants do jobs that put them at risk, put their health and their well-being at risk. Their legal status is the last thing on their minds during a global coronavirus pandemic. So Dallas supports these critical workers and ensures that that's one less thing to worry about. In Dallas, I know earlier there was CMS mentioned that there was about 34,000 plus DACA recipient workers who are essential here in Dallas. Many of these are worried about the Supreme Court decision coming up. And that's the reason why Dallas community organizations like Raíces and the North Texas Dream Team have been providing scholarships and pro bono consultations so that DACA recipient essential workers can renew their work permits before the Supreme Court rules whether or not DACA can be terminated. Dallas also supports its undocumented essential workers because ICE deportations continue to happen even as immigration officials assure us that they're not as happening. This year, the city launched a $200,000 public-private partnership with money from the Vera Institute of Justice to represent our essential immigrant workers. And by the way, 54% of this fund's clients are essential. Finally, on my last slide, testing, as we all know, is a huge problem. Dallas has recently expanded its criteria to test essential workers in clinics, hospitals, and grocery stores, regardless of whether or not somebody has the symptoms for COVID-19. As a city, we have also created a $660,000 publicly funded mobile testing program for some of our hardest hit zip codes. We all know that low income, minority communities, especially those that are immigrant, tend to work in industries like construction, healthcare, and other essential services. And it's critical that they feel supported and that they are not afraid of getting tested to know if they have the virus. The last initiative that I will mention is the small business program that the city created this month. 29.6% of our Dallas immigrant entrepreneurs work in the construction industry, and many of them are sole proprietors or independent contractors who've had a tough time getting forgivable loans from the federal Paycheck Protection Program. That's the reason why Dallas created a $5 million program similar to the Small Business Administration's disaster relief program. And to further assist our city's efforts, TBIC has partnered with elected officials like Congressman Mark Vesey and nonprofit lenders like People Fund and Business and Community Lenders of Texas to educate our small business immigrant community about the Paycheck Protection Program and make sure that they have access to it and that they understand this program in their own language. Finally, I just like to thank Don, and that's all I had prepared for y'all. I will say that cities like San Jose and Dallas are trying very hard to support our immigrant community because they are our future. And I'd like to pass it on to Laura, who also is just an amazing figure who can also explain what she is doing in New York City, in New York, the state of New York.
Thank you, Juan Carlos. Thank you to CMS, Donald, for the invitation and opportunity to share with you New York State's efforts to support its 4.5 million immigrants that have come from all over the world and experienced this to make our state their home. I am the Director of Immigration Policy and Research at the Department of State, where the Office for New Americans is hosted. Could we go to the next slide? Thank you. Immigrants have shown their heroic nature during this critical time. As your research has shown and Michael and Daniela outlined, they are strongly represented at 31% in some of the most critical and essential occupations on the front lines of the fight against the pandemic, from healthcare to elder care, food services, and delivery workers to daycare. They have done so also in the past. For example, during the Great Recession, immigrant business and formation rates increased by 50%, so they were a powerful force then too. Governor Andrew Cuomo has recognized the importance of the immigrant community to the well-being of the state, and over the years has taken definitive actions to ensure the continued success of all its immigrants, irrespective of status in New York. His welcoming stand towards immigrants and their contributions to the communities have been increasingly important in the face of the targeted actions on immigration at the federal level that we're all aware of. A stance that is represented in the creation of the Office for New Americans in 2013, which is the first of its nature in the country. Since its inception 7 years ago, the office has served over 250,000 immigrants. Could we go to the next slide, please? Thank you. So I'd like to go over the overall quickly the programs that we provide irrespective of the time. Through its network of opportunity centers, navigators, and other programs that you see some of them listed there in the slide, New Americans have received English language training, been assisted and advised on the naturalization process, connected to business resources, harnessing their entrepreneurial spirit, and in general, enhance their ability to become part of the family of New York. In 2017, Governor Cuomo launched the Liberty Defense Project. We call it the LDP often, which is the first in the nation state-led public-private legal defense initiative, ensuring that all immigrants, regardless of their status, had access to free, confidential, and expert legal assistance, including direct representation for those facing deportation. In 2019, the LDP program assisted a total of 10,897 individuals. Now we know that access to free immigration legal counsel is particularly challenging in rural and remote areas of the state. So ONA is proud to fund community-based legal providers throughout the LDP, through the LDP, and also in the last 2 years through our ONA legal counsels as well. So we now support over 60 immigration attorneys in New York State who tirelessly work to ensure that all immigrants receive legal assistance, and their service ensures that families and communities can stay together. As always, immigrants can also reach out for information on all of the services that we have, even some more than I'm sharing, across the state by calling into our ONA hotline, which is really one of our most important links to the community. It provides and continues to operate right now, providing information during these tough times from 9 to 8 p.m., Monday through Friday. Could we do the next slide? I'm wondering why my video is not up, but good to see you. So an unprecedented global pandemic that knows no borders has brought into sharp focus the intersection of the US immigration policies, and public health policy, and the unique challenges that immigrants face in the United States today. Even during these times under COVID-19, our centers and legal providers are finding innovative ways to provide assistance by using different online platforms like all of us are doing. For example, they are delivering online citizenship classes and mental health workshops, such as through our Golden Door program, which is, you may be able to see from one of our announcements on the corner on the slide, is engaging immigrant parents through a Zumba class. So we're giving the importance of that mental health for our families and continuing that. Given that our network had to deliver services quite quickly and remotely without prior experience, and thus navigating uncharted waters, the Office for New Americans implemented a best practice webinar series, bringing our immigrant service providers across the state together to identify best practices, how to deliver and take care of the obstacles that they were seeing, and ways to address those obstacles. So this has been very, very well received by our network. Our legal providers have faced particularly stressful times as well. While many courts were closed, you all probably know as deportation courts were not. However, our attorneys again continue to provide remote confidential consultations, online Know Your Rights workshops, and continue to advocate for their clients and provide representation. At times, especially during the beginning of the isolation time and during March, more or less, they were putting their own health at risk by going into court. They are truly on the front lines of legal support to immigrants across the state. So to quickly assess the needs of the immigrant community, we conducted a brief survey of our network, asking them what their clients' most pressing COVID-19 related needs were. And not surprisingly, the issues highlighted were that of addressing discrimination, hunger, job skills, and mental health. And we continue to work very closely today to try to assess that, how to assist them. But to ensure that families throughout the state have enough to eat while grappling with the economic fallout and food insecurity brought on by the pandemic, Governor Cuomo recently announced Nourish New York, a $25 million initiative to purchase unused agricultural products from upstate farms to donate to food banks. The Secretary of State, which is where the Office for New Americans rests, has been appointed by the governor to serve as a member of this initiative. About 50 food banks were selected by the Department of Agriculture and Markets and are purchasing goods such as dairy, fruit, and vegetables from 2,100 farms across the state. This program was feeding around 20,000 households within the first week. Also, to assist with the information and access to other food services available upstate, ONA compiled a statewide resources list, which we're sharing with our network and hotline especially, to help overcome an inherent limited coordination of information in our upstate communities. The survey I mentioned earlier also highlighted, and again, not surprisingly, job skills related worries. So in partnership with Upwardly Global, we held a webinar for our network on helping new Americans navigate the US job search process during COVID-19 and beyond, as Upwardly Global had made some of their tools available for free to the community until October 1st. So we're grateful for that from them. Could we go to the survey, the next slide 4, please, in our last one? Thank you. So our survey also highlighted the digital divide issues. Thousands of New York's most vulnerable are cut off from life-saving information about the pandemic, and nearly half are shut out of online remote learning because they lack internet access, computers, smartphones, expensive data plans, digital literacy skills, which are also a barrier from employment. So to help protect immigrants from the coronavirus and to enable them to continue to learn and get information that is confidential and up to date, the state of New York, through ONA, expanded its partnership with the mobile English language learning program, CELED. I had highlighted it in the first slide, but through it this time around, we're providing an easy to read, accurate, and up-to-date COVID-19 guide, essential skill building courses like reading, math, work readiness, with live coaches for free through the end of the year. Now you can access it with no internet or smartphones needed. This is what we're calling CELED's 1 Million Learner Challenge. We launched it on May 14th. So participants only have to be able to listen to audio lessons, text or message on any mobile device to use CELED, even by calling in on a basic phone, as I mentioned earlier. Those that have tablets and access to the internet can use the app or web browsers or even through WhatsApp. This universal accessibility will enable the state of New York to reach, teach, and support the hardest to reach adults, including farm workers in rural New York, ensuring that they are not left behind. So please help us share this tool so we can even surpass the 1 million users. So I have the number, right, the information on this slide, but I'm happy to share more about it later. And again, it can be also accessed from the rest of the country. So thank you very much for the opportunity again to share about what we're doing. Long road ahead, and thank you for the other previous presenters too for the work they're all doing, because we know it's really difficult times and it's hard to be able to get to everybody. So thank you again. John, I'll pass it on to you.
Thank you, everybody. Those were all terrific presentations, and we're very grateful to all of you. Let me just, what we're going to do is we're all going to be looking at the questions separately, and then I will ask kind of the panelists in order to address the questions that they feel qualified or that are directed to them. But before I do that, let me just lift up a few themes from what I thought were great presentations. Mike at one point said that immigrants will be essential to the recovery from the pandemic and the economic recovery too, and I think that that's absolutely true. Daniela spoke of DACA recipients as both embedded and invested in our communities. And it just occurred to me that it's time now finally for our nation to fully invest in DACA recipients. And that should have happened, of course, a long time ago. I was very interested in Zulma's point that the pandemic has illuminated inequities in Silicon Valley and, of course, elsewhere in the country. And as a result, it's required San Jose, in order to be equitable, to deliver more targeted services. I thought that was a very interesting, almost a paradox. Juan Carlos lifted up a lot of important things, but I was focused on the importance of legal representation to allow immigrants to focus on work, to continue to work, continue to serve their community and their nation. There's this incredible anomaly that people don't have status or that they're facing removal proceedings, and yet they're totally essential and important members of the community. And Laura focused on all the great work that's being done in New York State in a very integrated way on discrimination, hunger, job skills, mental health, which is a huge issue, educational tools, and also best practices during the pandemic, which I'm sure is very, very valuable. So thank you, all of you, for all of the great points and information that you provided. Maybe we should just go around in the order that we spoke. Mike, do you want to start? And you see a question or two that you'd like to answer?
Yes. So somebody asked about how we estimated DACA recipients who held essential jobs. So I'll just mention, I'll go over the methodology very, very briefly. We selected those who met DACA eligibility in terms of their age, birth dates, year of arrival in this country, and how old they were at the time, out of a pool of likely undocumented immigrants. So we flagged likely DACA recipients, and then we looked at administrative data from the US CIS, the US Customs or Citizenship and Immigration Services, to control for these individuals' places of birth. So then that's how we arrived at our estimates, essentially, and then we matched them to the essential worker categories that I already mentioned, that we matched the Department of Homeland Security critical essential infrastructure categories to census codes using the American Community Survey data. So that's in a very brief nutshell, and if anyone wants to talk about this further, feel free to email me, and I can talk about that.
Thanks. Daniela, do you want to jump in?
Yeah, so there was a question about when the Supreme Court might come out with a decision on DACA. So several cases still remain open and to be decided by the Supreme Court, including DACA. From here on, decisions will be made public at 10 a.m. every Monday. And it is possible that the court may add additional decision days once we get into June, since oral arguments were pushed by 2 weeks into May. So, but we will certainly hear an outcome in the next few weeks.
Thank you. Zulma, maybe you've answered some online, have you? Because
Yes, I believe I've answered all the questions specific to San Jose. Is there a particular one you would like me to point out?
No.
I don't think that there was anything significant there.
Okay. Any general question that you'd like to respond to, or would you like us to move on to Juan Carlos?
Let's move on to Juan Carlos, and I'll keep monitoring the questions.
Okay, thank you.
So I had a question about how the Dallas Deportation Defense Fund works. So the fund is partially funded by the Vera Institute of Justice, which is based out of New York. And 50% of it, and the other part is funded by the city of Dallas. But the program itself is administered by the International Rescue Committee. And it's really important because studies show that somebody who has legal representation is 10.5 times more likely to win their immigration case. So the city saw a need for this fund and basically applied for a grant from the Vera Institute of Justice. And Lisa Dio has been an amazing advocate on getting this fund, and she has done a tremendous job.
Okay. Laura?
I'm looking for some, I've heard that before. There was a question earlier, I was trying to look for it again, about the support for farm workers and support for those individuals with developmentally disabled family members. And I wanted to find it to be able to provide some information later and a contact to our office, but obviously the 800 number I mentioned or my email will be perfect. We do have a program where we're trying to provide and build the capacity of our organizations across the state that can advocate and provide services for families, immigrant families with developmentally disabled members. We know language is one of the biggest barriers that we have heard so far from them, but we have a navigator that can assist and help them to try and find information. And also on public charge for the developmentally disabled. We also have information on that because sadly enough, it does have a different effect and one that is not very positive. However, we're trying to promote that right now they can access health. There was another one on farm workers' impact there. And as I mentioned, one of our ways to reach out to the farm worker community is that program, CELED, because that can provide them with access in communication and even texting back and forth information on services and on where the status of COVID-19 is. So those are two, but farm workers are definitely one of the community that we represent through our attorneys. So those are the two that I was looking through. I'm going to continue to look for more of the questions and see some that are applicable. I think there was one about DACA and what policies, what can be done to provide support for them. Obviously, one of the things like Zulma mentioned earlier, and I think other presenters, was the importance to get an attorney to evaluate their situation. Also, to discuss if they're employed, to talk to their employer, because the possibility, if there is a negative response by the end of this month, which is very close, and we think it most likely will be, it will be very important for them to look at and evaluate their options employment-wise. If they are at a university, we're always recommending reach out to your alumni network and also assistance there to provide options for that type of being able to status to stay and be prepared, be informed. But there are considerations in Congress as well, the HR 6, that are things that have to, hopefully will be addressed in the case of a negative response from the Supreme Court. So I think I covered the ones that I just saw, but I'll continue to look as well.
There was one more about California has extended unemployment benefits to the undocumented. Is New York considering anything like that?
That's something that would be coming from the governor's office. Right now, as the Department of State, we're looking at other options to facilitate, job employment opportunities and so on.
Okay, great.
And just to clarify, Governor Newsom provided a package of funding for the undocumented community. It's essentially, and then it would be matched by philanthropy. It's essentially about $500 per person, but it's not unemployment benefits. If you're undocumented, you don't have access to those in the state of California, but you do have access to some funds based on Governor Newsom's financial relief program.
I see that there's a question about how this situation affects refugee resettlement, and basically it's more or less suspended at this point, the refugee program, and it already had been at a very low level. And of course, refugees themselves have to work, and we don't know the numbers, but I'm sure that they work at high rates in essential worker job categories. But so they may well be affected in various ways as workers. But we are committed, and I think a lot of people are committed to bringing back the resettlement program and making it stronger than it was before. So I'm hopeful about that. That's about the most we can say, I think, about refugee resettlement.
Got another question over here about businesses and about keeping immigrant workers employed. And I'm just getting a hang of this chat box, so I'll just read the question. Is, do foreign workers include the undocumented? Do they benefit from the $2 trillion CARES Act support for businesses? This is from Manolo. So the way the Paycheck Protection Program works is that any business owner with a tax identity, an EIN or social security number can apply for a federally forgivable loan. They just have to testify that they are legally present in the country. So while it's really hard for undocumented business owners to get this assistance, it's not impossible. Certain lenders will work with undocumented business owners, but it's definitely a very tricky thing. And the purpose of the program was to ensure that all employees are kept on payroll and that their wages aren't cut or diminished. But what is good about the program is that even though it doesn't directly help undocumented business owners, is that it can still keep undocumented workers employed, because when you apply for it, you don't have to show that your workers are legally present or legally authorized to work. You just have to show how much in payroll your business has. Now, forgiveness, however, is another part. It's another tricky part that we're still trying to figure out, is whether businesses have to show all of their employees. There's actually, on the forgiveness form, when you apply for your loan to get forgiven by the federal government, there's a worksheet where you have to fill out every single employee that you have, and you have to put their employee identification number. So there's a lot of worry that potentially your workers could have to be identified, but that's still something that is changing, and the form that currently exists will probably be edited or revised so that businesses don't have to identify all their employees. The government just wants to know that you still have the same number of employees as you had before the pandemic happened.
Others that want to jump in?
Yes. There's a question about what advocacy efforts exist now to support DACA recipients, and how to advocate for them in a public way. So recently, the Supreme Court allowed for an additional brief to be submitted in support of DACA recipients, given the significant number of healthcare workers who have this status. However, the solution really is a legislative fix. Congress needs to enact a bill that provides an eventual path to citizenship. The HEROES Act, for instance, provides a very temporary relief for some DACA and TPS recipients who are in the front lines that would expire 90 days after the pandemic ends. However, we need to, the public should advocate for a more permanent fix like the DREAM Act. And given the particular situation in Congress, there are other ways to advocate for DACA recipients, as mentioned earlier. Supporting your staff if you employ any DACA recipients. Also, universities can provide very vocal support by making sure that resources are allocated and are clearly explained and communicated to undocumented students. In this particular slide that you see that you have in front of you, there are several resources for other stakeholders that show ways to support DACA recipients at this time.
We do have a question about working in people that are COVID infected in Mississippi chicken plants, and then the problem of ICE detention centers in Louisiana. And as it turns out, our last or our second to last webinar was actually on detention in Mississippi, Alabama, and Louisiana. So we would be happy to, if you're not already in contact with some of those groups, to let you know who we were relating to in preparing that webinar and who we've worked with in the area. There's a question about transitioning from refugee status to immigration status, and if you're resettled as a refugee, you can apply to become a permanent resident a year later. So that's the way it works in the US. It's just that nobody's being admitted as refugees at this point.
There's a question from Gerardo Martí about what is the approach from business leaders and corporations to DACA, and is it helpful to persuade Republican leaders perhaps? So that's a good question. Dreamers and immigration, undocumented immigrants, these are issues that are bipartisan. They should be bipartisan. The presentation, the research that CMS just showed right now, all of that data underscores how critical immigrants are to our economy. This is a point that both Democrats and Republicans can agree on, is that immigrants are vital. They are consumers, they are entrepreneurs, they underpin our most essential sectors like construction, manufacturing, healthcare. Like those facts are undisputable. So it is very helpful to approach parties like the Republican Party or the Democratic Party with these facts that cannot be denied. The question is really a political question, is there the political willpower for Democrats and Republicans to come together on this issue? And it's pressure that needs to come from not just the immigrant rights community, which is very, very important, but it also needs to come from businesses. We, in Texas, for example, have several restaurants that employ immigrants, and they vouch for their employees because most of their employees are immigrant, and they are afraid that if this talent pool dries up, that their businesses are going to suffer. And as states like Texas reopen, restaurants are going to be some of the first to start rehiring people from the immigrant community. So this is really another argument that can be used when talking with our elected officials.
Thank you.
There's a question that from Godwin mentioning about given that the immigrants are vital, and as your research has proven and shown, The question is there any equity in the treatment and support of corona positive immigrant and non-immigrants in New York and San Jose? I can answer. I think, individuals should be able to access all health services. It doesn't matter the immigration status throughout the COVID-19. If they're testing positive, they are eligible for all the treatment. One of the things that I know has been very much in the mind of all the immigrants, and especially the undocumented, is, the documented applying for a change in status, is will this count, for a negative under public charge, or will it be considered a trade against it if I access these health services, or will they be nearby and detain me? We know the USCIS and on their website has stated that they will not be near the health centers. They will not be near areas to be detaining. But we all doubt, we all have all those concerns. And also they're saying that it will not count as public charge. But one of the things that we've been trying to get the message out is, while this is stated and this is an official statement, please, it's very important for all immigrants to keep their documents, because they do ask under USCIS to make sure, that it will be on a case-by-case basis, to make sure to have proof of their bills, of their access, that they've received services as COVID-19 patients. So we've always been trying to say through the last few months, make sure that they have that documentation, copies of those, because, we all worry of that fear as well.
Yeah, I would say that the same for California, or at least in the Bay Area, that, for example, we recently stood up another 2 testing sites in East San Jose where the larger population of Latinos live. They are the essential workers. They're hardest hit by COVID. So ensuring that we have accessible testing sites for anyone who needs them, as well as access to healthcare. And we've tried to make it clear that, regardless of immigration status, or regardless of whether or not you have medical insurance, there's access to healthcare in the Bay Area and really all California. So immigration status is not an issue here related to healthcare.
We should probably wind up, I think, because we have 75 minutes reserved, and our guest speakers have been very kind with their time, and we really greatly appreciate it. We will get back to some of you that we didn't respond to in this session afterwards. I see a couple of questions on the Central American Minors Program, for example. I can answer those, but I'll send you a little note. But again, thank you, Zulma. Thank you, Juan Carlos. Thank you, Laura, for your great presentations and for the terrific work that you do and that your communities do. We're really inspired by it, and we hope that it more and more becomes kind of a model for how the federal government actually relates to immigrants as well. But really what we need. So, and thanks to my colleagues, Mike and Daniela, for all of their terrific work on this research.
Yes, for sure. Thank you, and thank you for sharing that research with us as well.
Great.
Thank you, everybody.
Okay, thanks. Thank you all.